My name is Dr. Meghan Marcum. I am a psychologist and the Associate Clinical Director of Sovereign Health of California. I would recommend patients come to Sovereign Health for a lot of different reasons, but first and foremost that we have an intensive treatment program that's based off of evidence-based treatment modalities. So we're not just sitting here talking about, what might be helpful. We're using practices that have been supported by science and the scientific method. For example, we have cognitive rehabilitation, which science has shown that it helps patients who have a chemical dependency or alcohol diagnosis. It helps people with depression, with anxiety, with eating disorders, and so we use that. We also have biofeedback. We have a brief model of intervention, CBT, cognitive behavioral therapy, that we use with most patients for individual therapy. We also have a lot of things that other treatment facilities don't have. We have the registered dietitian who sets the menus for the patients when they're in treatment. They're provided food and meals that are outlined by the dietitian. We have treatment every day of the week, so a lot of programs don't have care on Saturday and Sunday or treatment on Saturday and Sunday, and the patients go home and have a lot of problems. Sometimes relapse, sometimes just they're not ready to go back home and then come back on Monday. So we have treatment every day of the week, which we think is special and that makes us different. We also have a very high quality staff. Every patient receives a therapist who has graduated with a master's degree in counseling or above, and every patient also sees the medical director and the psychiatrist that work in collaboration with the primary therapist, which also I think makes us different. I like when the patients make progress, when they start to light up after a couple of weeks and they say, that group was awesome, I learned a lot, I'm so excited to practice these skills with my wife, with my sponsor, with my children. So once they start to connect the dots and, like I said, light up, that's my favorite part about working here, is seeing them make progress and get better. Forced treatment is never a good idea. I can tell you that you really want your loved one to commit to making these changes for themselves. If they're not motivated to participate in treatment, then it doesn't matter what we say in group or in individual therapy. The change has to come from within. So from the family members, if you could get the loved one's support, or if you could all come together and take a firm position that this is something that you believe in for them because you care about them and because you want to see them get healthy, that is probably the most important thing prior to sending anybody to treatment. Discharge planning is an important part of treatment at Sovereign Health of California. We know that 30 days is not enough to continue making progress. The patients are going to need some additional assistance, whether that be medication management or individual therapy. Sometimes it's a combination of both, but we offer assistance in setting those treatment modalities up prior to discharge. So everybody that comes in, if they're going to stay with us in the area, then we'd like for them to continue outpatient treatment here. They can continue working with their same therapist and the same psychiatrist. However, if they're from out of this area and they're going back someplace outside of transportation limits, then we assist in providing them with a doctor who can continue medication management for prescriptions, and an individual therapist or counselor who can provide mental health assistance when they discharge from here.